that they may also be conditioned to the therapy context. And it is really, I mean, I can see this process during therapy, that when you talk about fearful events or I mean in the past, or when they imagine they need to make some exposure or something like this, I mean, during the therapy, it's not so bad, but afterwards, sometimes they skip therapy because it is working. All this imagination of and the fear we induced during therapy is working. So it is very crucial point in the therapy of anxiety disorders. I will tell you something more about how can we manage it. Okay, but I made a study also that is somehow connected to the risk of this fear conditioning in the psychotherapy. On the same group, the same cover story, but now show them 3 blocks as earlier, as in the earlier study, but now in each block, before each block, we told them that, for example, the green cross will signal neutral pictures, it was dark yellow cross will signal unpleasant but not spider pictures, and the blue cross will signal spider pictures. And because I wanted to investigate whether they already get this selective attention to signals of threat. And what we get? It looked like this. And the same. Okay, now, similar to the earlier graph, just look in the middle. This is the 0 is the onset of the cross. Yeah? And red are spider-phobics, blue, black are controls. And you can see not so big, but still a significant difference between spider-phobics and controls already when the cross is going on. So this difference is significant. So this replicates actually the data from pictures, and there is no difference in both conditions, safe and non-phobic threat condition, before we told them about spiders, but there is a difference after. Already for these instructed cues, for these crosses, you can see the difference between spider phobic, even greater than during the spider condition. Okay, I won't tell anything more about it, but because this is actually a replication. Okay, and most important here, just look at the bottom. The thick red ERB, this is the event-related potential to stimuli signaling spider pictures in spider phobics, and the thick black to stimuli signaling spider pictures in controls. And this is a significant difference. Controls look, they respond to the stimuli signaling spider pictures similarly to neutral pictures, and here spider phobics have a greater LBP. We can't call it LBP because it is also here as the LBP, an occipital parietal cortex. And in the time window, this is the difference between the cross for spiders and the cross signaling neutral pictures in spider phobics. So this is a significant difference. So actually, wait a minute, okay. So this study also showed that there is an increased hypervigilance and spider phobics exposed to phobic threat, and this hypervigilance is long-lasting, and that there is an increased selective attention for stimuli signaling spider pictures. Okay, let's move to the psychotherapy. So there is a really great risk, and I told you about it, and I can see it in the therapy, that we condition our anxiety patients to the therapy context. We condition a few response. So, how we can manage this? It's not easy. What we can do, because the avoidance and approach systems, they cannot work together. And what we are doing in the psychotherapy, I mean, I'm not sure whether it's investigated already experimentally, but what we are doing in psychotherapy, we use the approach system. We take a lot of time to develop the motivation to get a new experience with fear-relevant stimuli. And we try them to imagine how it will be when they manage to do it. What will change in the life of the patient if they manage to do it. Yeah. So we keep them in this approach system. They are motivated to do it because they imagine the positive outcome. And yeah, by this way, we stop the avoidance system and we activate the approach system. So actually we should do it in every session, that we just say goodbye, and before we say goodbye, we activate the approach system, and we do it also. I will already tell you that we expose our patients, and we should do it also before the exposure, because it is too strong. It is too hard for them to go into the field experience when they always imagine that they will encounter this field event, this field situation. So we use this approach system. It is called approach priming. Although, as I said, it is not really investigated how it works, and if it works, I mean, we can see it, but we don't know. We didn't make a study with a number of hundreds of patients, or I don't know. We need to investigate it. Okay. This is the main point in the psychotherapy of anxiety patients. They need to get a new experience. And this is the experience that the field event or stimuli are not dangerous. They knew it, actually. Most of spider phobics know that the spiders are not dangerous here in Europe. But they still are afraid of. Okay, now I will do a little bit more about this main goal of the psychotherapy, how to create these new associations. But before I tell you about this, I will go back to the point I told you, that we have to try not to activate negative imagination during the therapy. I did a study using EEG, showing how the spider phobics and controls these neutral and pleasant spider pictures. And a week later, I invited these people once more and showed them new and old spider unpleasant and neutral pictures. And just look here to the right. There were no difference between new and old spider pictures and controls, but there was a significant difference between old and new spider pictures in spider phobics. This is a typical old new effect, EOP old new effect. So it means there is a greater, more intense retrieval of old spider pictures. What does this mean? Okay, it is probably that if these new events or imaginations are activated, they first of all they elaborate them more intensively, as we saw, and probably they have this so-called post-event recollection. So they go out from the therapy, and these spider pictures are in mind, yeah, and that's why they are better remembered, probably. And the problem is that surely that they will get the fear system activated when they are doing it. They will avoid when they are doing it, and this is the next point. We have to manage during the therapy. We don't want to make a fear condition during the therapy. We want them to learn something new about feared events and situations. So how can we do it? There's a lot of animal studies about extinction of the fear response, and we do it during the therapy. We need to build this, we need to activate the approach system in order to reduce the avoidance system activation, and then we need to expose them to events and situations they are scared. The best thing is when we do it at once, I mean, so that they don't get this recollection after the session. So the best, for specific phobics, the best thing is to do one long session, so that they don't get this old new memory and so on. And there are some therapists who are doing it. I mean, there are not a lot of spider phobics who want to get to the therapy here, but from specific phobics there are height phobics. This is common. And what phobics are? Plane phobics, who are afraid of going by plane. What kind of phobic? Blood phobics sometimes. And injection phobics. These are common. And there are also phobics, people who are afraid of a dentist. But still, the amount of specific phobics who are going to psychotherapy is really small. But still, we need to use such simple disorders to get our knowledge how it is working. Because if you work with depression, it is much more complicated. So we start with specific phobia. How to do it so that it is effective? First of all, you can intensify the extinction memory. And this is the memory, like, you can tell, spider is not dangerous. This is a new connection. Yeah? This is new extinction memory. You can use pharmacotherapy, but there are also data that you can reactivate the extinction memory. You do a session with a spider phobic, and then one day, hard session. I mean, they start with looking at a plastic spider, and then they take this plastic spider in the hand, and then they look at a live spider, and then they touch the live spider, and then they take the live spider in the hand, and then they... Do you want to know?